The challenges faced by individuals living with spinal cord injuries are significant and enduring, impacting motor and sensory functions, as well as autonomic control. The quest for effective treatments and improved care remains a paramount concern for the medical and scientific communities. This report offers a focused examination of the significant breakthroughs and evolving paradigms in spinal cord injury treatment that have emerged between 2020 and March 18, 2025. This period has witnessed notable advancements in both the immediate management of acute injuries and the long-term treatment of chronic conditions. The dual purpose of this presentation is to provide a comprehensive understanding of these developments, fostering hope among patients and their families, while simultaneously informing and motivating professionals, investors, and charitable organizations within the spinal cord injury research and treatment ecosystem. The increasing number of individuals affected by spinal cord injuries globally underscores the urgency and critical importance of continued research and development in this field. This report aims to bridge the gap between the complexities of scientific advancements and the lived experiences of patients, fostering a sense of hope that is firmly grounded in tangible progress and ongoing efforts to improve functional outcomes and quality of life. The initial hours and days following a spinal cord injury are critical in determining the extent of long-term neurological deficits. Immediate and appropriate medical management at the injury scene plays a vital role in minimizing secondary damage to the spinal cord. Emergency personnel are trained to rapidly stabilize the spine, typically using rigid neck collars and carrying boards to prevent further movement and potential exacerbation of the injury during transport to a medical facility. In the emergency room, the immediate focus shifts to maintaining the patient's ability to breathe, preventing shock, and immobilizing the neck to avoid additional spinal cord damage. The medical team also works proactively to prevent potential complications such as bowel and bladder dysfunction, respiratory or cardiovascular issues, and the formation of deep vein blood clots. Pharmacological interventions have historically played a role in the acute management of spinal cord injuries. Methylprednisolone, a corticosteroid, was previously considered a standard treatment option administered intravenously to reduce inflammation and swelling in the spinal cord, which are significant contributors to secondary injury. The rationale behind its use was the potential to protect nerve cells from further damage and promote nerve regeneration through its anti-inflammatory effects. However, recent research has indicated that the potential side effects of methylprednisolone, including an increased risk of blood clots and pneumonia, may outweigh its benefits. Consequently, current guidelines generally do not recommend the routine use of methylprednisolone following a spinal cord injury. While some might still consider high-dose steroids as a cornerstone of acute spinal cord injury treatment, the overall consensus within the medical community is shifting towards a more cautious approach due to the lack of consistent evidence supporting significant neurological improvement and the documented risks. In parallel with refining pharmacological approaches, researchers continue to explore emerging neuroprotective strategies aimed at mitigating the cascade of secondary injury mechanisms that follow the initial trauma. Therapeutic hypothermia, which involves significantly lowering the body temperature for a defined period, is one such experimental treatment being investigated. The premise is that reducing body temperature could help prevent damaging inflammation and slow down metabolic processes that contribute to cell death after injury. While preclinical and early clinical trials have suggested potential benefits, further research is needed to determine the optimal methods of administration, the target temperature range, and the ideal timing for initiating this therapy. The complex cascade of secondary injury in spinal cord injuries involves a multitude of cellular and molecular events, including axonal disruption, inflammatory responses, apoptosis, demyelination, and the formation of a glial scar. Understanding these intricate processes is crucial for developing targeted neuroprotective interventions. The challenge lies in translating the promise observed in preclinical studies into clinically effective treatments for humans, as many neuroprotective agents that showed efficacy in animal models have failed to demonstrate significant benefits in human clinical trials. This highlights the complexity of spinal cord injuries and the ongoing need for a deeper understanding of the underlying mechanisms of injury and potential therapeutic targets. Optimizing hemodynamic management in the critical care setting is another crucial aspect of acute spinal cord injury treatment. Maintaining adequate blood flow and perfusion to the injured spinal cord is essential to prevent further damage and support neurological recovery. Updated clinical practice guidelines provide recommendations for maintaining mean arterial pressure within a specific range for several days post-injury to optimize spinal cord perfusion. These guidelines reflect the ongoing efforts to refine hemodynamic management strategies based on the latest research and clinical experience. Monitoring physiological reactions at the injury site is an area of ongoing investigation to better understand the impact of hemodynamic control and to define more precise mean arterial pressure targets and their neurological consequences. Surgical innovations have also played a significant role in advancing the treatment of acute spinal cord injuries. There is a growing emphasis on early surgical decompression and stabilization of the injured spine to minimize secondary injury and improve neurological outcomes. Updated guidelines in 2022 strongly recommend surgical decompression within 24 hours of the spinal cord injury, based on a comprehensive synthesis of available literature, including findings from the surgical trial in acute spinal cord injury study and subsequent research. This reinforces the understanding that timely surgical intervention can help stabilize the spine, prevent pain and deformity, and relieve compression on the spinal cord caused by bone fragments, herniated discs, or other factors. While early surgery within 24 hours is generally recommended, the definition and effectiveness of ultra-early surgery, defined as surgical intervention occurring less than 8 hours or even 4 hours after injury, are still under active investigation. Some studies suggest potential benefits of ultra-early surgery, but definitive evidence is still lacking, and future research aims to establish uniform definitions and clarify its role in improving patient outcomes. For individuals living with chronic spinal cord injuries, the focus of treatment shifts towards neurorestoration, functional improvement, and enhancing overall quality of life. The period from 2020 to 2025 has seen significant advancements in various neurorestorative therapies, offering renewed hope for functional recovery. Cell-based therapies. Transplantation of cellular material to the injured spinal cord aims to replace damaged cells, promote regeneration, and modulate the hostile environment that inhibits recovery. Neural stem cell transplantation has shown promising results in clinical trials, demonstrating long-term safety and feasibility. A Phase 1 clinical trial, led by researchers at the University of California San Diego School of Medicine, for instance, implanted human spinal cord-derived neural stem cells into the damaged spinal cord tissue of patients with chronic thoracic spinal cord injuries. The study reported that the transplantation procedure was well tolerated, with no serious adverse events. Notably, 2 out of the 4 participants exhibited significant and durable neurological improvements, including enhanced motor function, increased sensory scores, and improved electromyography activity, sustained for up to 5 years post-transplantation. While the efficacy of cell therapy in humans is still being established, and most current trials utilize mesenchymal stem cells, these findings underscore the potential of neural stem cell therapy to partially restore function in patients with chronic SCI. Mesenchymal stem cell therapy is another area of intense research interest. MSCs, derived from sources like bone marrow or adipose tissue, possess anti-inflammatory properties and can promote vascular regeneration and the release of neurotrophic factors, making them promising candidates for SCI treatment. Clinical trials have reported improvements in ASIA sensory and motor scores in patients receiving MSC therapy. Researchers are actively investigating optimal transplantation strategies, including cell source, dosage, timing, and route of administration. Compared to stem cells, MSC-derived exosomes, which are small vesicles secreted by cells, offer potential advantages such as non-tumorigenicity, structural stability, and low immunogenicity, making them promising candidates for preclinical SCI research. A Phase 2 clinical trial, for example, indicated the efficacy of combined intrathecal injection of Schwann cells and bone marrow-derived mesenchymal stem cells in improving neuropathic pain and quality of life in patients with complete SCI. While numerous investigations in animal models have shown functional improvement after cell transplantation, the widespread clinical efficacy in humans requires further validation. Research also continues to explore the therapeutic potential of other cell types, such as Schwann cells and olfactory ensheathing cells, for SCI repair. These cells have shown promise in preclinical studies for their ability to promote nerve regeneration and remyelination. Gene therapy. Gene therapy offers another exciting avenue for treating chronic SCI by targeting specific molecular pathways involved in nerve regeneration and repair. Researchers are focusing on intracellular signaling pathways that regulate axon regeneration, such as the JAK, STAT, mTOR, and DLK pathways. By manipulating these pathways through gene delivery, the aim is to stimulate nerve regrowth and functional recovery. Preclinical studies have shown that targeted overexpression of factors like FGF22 using viral gene transfer can improve circuit plasticity and functional recovery following SCI in animal models. A meta-analysis of preclinical studies published in 2020 indicated that gene therapies were associated with improvements in locomotor score and axonal regrowth in animal models of SCI. Clinical trials are also underway to evaluate the safety and efficacy of gene therapy approaches in humans, such as a Phase 1b/2, a trial investigating a gene therapy vector for neurogenic bladder dysfunction resulting from SCI. Controlled release systems, like photocurable scaffolds delivering siRNA and growth factors, are also being developed to enhance the effectiveness of gene therapy for SCI. Neuromodulation spinal cord stimulation, SCS, neuromodulation techniques, particularly spinal cord stimulation, SCS, have emerged as powerful tools for improving function after chronic SCI. Epidural spinal cord stimulation, ESCS, involves implanting electrodes over the spinal cord to deliver electrical currents that can restore locomotion and motor control in individuals with even motor complete injuries. Studies have demonstrated that ESCS, when combined with intensive physical rehabilitation, can enable individuals with chronic SCI to achieve assisted or even independent stepping and standing, enhance muscle activity, and improve walking speed and overground walking ability. Furthermore, ESCS has shown potential in improving autonomic functions, such as bladder and sexual function, airway pressures, and bowel movements. Research also indicates that trunk-specific ESCS can improve trunk stability and control in individuals with cervical SCI. While ESCS offers significant promise, potential off-target effects on the autonomic nervous system, such as inducing autonomic dysreflexia, require careful monitoring. Transcutaneous spinal cord stimulation, or TSCS, is a non-invasive neuromodulation technique that delivers electrical stimulation through electrodes placed on the skin over the spine. Research has shown that TSCS can improve motor function, gait parameters like walking speed and distance, and pain management in individuals with chronic spinal cord injury. Combining TSCS with activity-based therapy has been found to increase target-specific muscle strength and walking ability more effectively than activity-based therapy alone. While generally considered safe, some studies suggest that TSCS may not improve autonomic regulation and could potentially trigger autonomic dysreflexia in some individuals. Brain stimulation. Transcranial direct current stimulation, or TDCS, is a non-invasive brain stimulation method that involves applying a low-intensity direct current to the scalp to modulate brain activity. Often combined with motor practice, TDCS has been shown to enhance brain plasticity and improve motor function in both upper and lower extremities for individuals with spinal cord injury. Neuroprosthetics and assistive technologies. The integration of advanced technologies like neuroprosthetics and assistive devices is significantly improving the lives of individuals with chronic spinal cord injury. Implanted spinal cord neuroprostheses, when combined with rehabilitation robotics, can deliver precisely timed electrical pulses to stimulate paralyzed muscles in coordination with robotic movements. This seamless integration enhances rehabilitation therapy and has shown immediate and sustained muscle activation, with some participants even regaining improved voluntary movements after the stimulation is turned off. The laparoscopic implantation of neuroprosthesis, or LION procedure, is another promising neuromodulation technique involving the implantation of electrodes on lumbosacral nerves. Studies have demonstrated that LION therapy can lead to significant improvements in mobility, sexual function, and bladder and bowel control in individuals with chronic spinal cord injury. Brain-computer interfaces, or BCIs, represent another transformative technology that can bypass damaged neural pathways and restore motor control, communication, and independence for individuals with paralysis. These devices interpret brain signals and translate them into commands that can control external devices, such as robotic arms or computer cursors. Robotic exoskeletons are wearable devices that provide support and assistance for overground walking and can enhance rehabilitation training. Research has shown that the use of robotic exoskeletons can lead to improvements in various functions, including bladder and bowel function, pain, spasticity, bone density, and walking speed. However, clinical practice guidelines often recommend against their use in the acute phase of injury or for individuals who are already ambulatory. Innovative assistive devices continue to be developed to improve independence and quality of life for individuals with spinal cord injury. The dorsal grasper, for instance, is a wearable device developed by UC Berkeley engineers that utilizes voluntary wrist extension to control robotic fingers on the back of the hand, enhancing grasping functionality for individuals with tetraplegia. This device allows for collaborative grasping, enabling users to manipulate objects more effectively. While assistive technology offers significant benefits, issues such as non-compliance and abandonment due to factors like medical improvements or device limitations need to be addressed to maximize their impact. Nerve transfer surgery. Nerve transfer surgery has emerged as a promising surgical option for restoring upper extremity function in individuals with cervical spinal cord injury. This technique involves transferring a working nerve from above the level of injury to a damaged nerve below the injury, with the goal of reanimating paralyzed muscles. Nerve transfer surgery can improve movements such as straightening the elbow and wrist, opening and closing the hands, and overall ease in performing daily activities. Patient selection is crucial and typically involves individuals with cervical injuries, some residual arm function, and ideally surgery within 12 months of injury, although it can sometimes be effective even years later. Outcomes reported include significant gains in upper extremity range of motion and strength, leading to increased functional independence. Social media platforms have become important avenues for information sharing and support within the spinal cord injury community regarding nerve transfer surgery, highlighting the growing interest in this procedure. While nerve transfer surgery offers substantial benefits, patients should have realistic expectations, as it may not fully restore pre-injury hand and arm function. Physical therapy. Physical therapy remains a cornerstone of spinal cord injury rehabilitation, with increasing integration of advanced technologies to enhance therapeutic gains. Robotic exoskeletons are being used for robotic-assisted gait training, showing benefits in improving walking independence, bladder and bowel function, pain, and spasticity. Functional electrical stimulation, or FES, applies electrical pulses to stimulate muscles and nerves, leading to improvements in hand movements, bladder and bowel control, and even respiration. FES cycling is another valuable application for increasing muscle power and endurance. Virtual reality, or VR, is also emerging as a neurotherapy tool that can stimulate neurological pathways and aid in recovery. Occupational therapy. Occupational therapy focuses on promoting functional independence and participation in daily activities through the use of assistive devices, environmental control adaptations, and various therapeutic techniques. Occupational therapists assess, recommend, and train individuals in the use of a wide range of assistive devices for mobility, self-care, and environmental control. Techniques like dry needling are also being utilized by occupational therapists to reduce spasticity in spinal cord injury patients. Activity-based therapy, or ABT. Activity-based therapy targets the neuromuscular system below the level of injury with the goal of retraining the nervous system to recover specific motor tasks. ABT, which includes modalities like load-bearing, locomotor training, and resistance training, has been shown to improve body satisfaction and perceived quality of life in individuals with spinal cord injury. Community-based neurorehabilitation and telecare. There is a growing recognition of the importance of community-based neurorehabilitation programs to increase accessibility and convenience for individuals with spinal cord injury. The application of telecare, including virtual therapy sessions and remote monitoring, is also expanding, offering flexibility and reducing the need for frequent travel to specialized centers. Telecare cognitive behavioral therapy, or CBT, has shown to be a feasible and effective approach for managing the emotional well-being of individuals with spinal cord injury. Emerging therapies with life-changing potential. Several emerging therapies hold significant potential to revolutionize the treatment of spinal cord injuries. Researchers at Northwestern University have introduced an injectable therapy utilizing fast-moving dancing molecules that has demonstrated the ability to repair tissues and reverse paralysis after severe spinal cord injuries in preclinical studies. These molecules form synthetic nanofibers that mimic the extracellular matrix and can effectively communicate with cells, promoting regeneration. This therapy is also being tested for its ability to regenerate cartilage and bone, with the researchers aiming for FDA approval for clinical trials in spinal cord repair. Acute intermittent hypoxia is another promising multifunctional therapy being investigated for spinal cord injury. This approach involves exposing individuals to modest, intermittent periods of low oxygen, which has been shown to elicit neuroplasticity in motor nerve cells that drive diaphragm contractions and breathing. Preclinical models have demonstrated improvements in both breathing and limb function with this therapy, and several human clinical trials are currently underway to explore its efficacy, often in combination with traditional rehabilitation and pharmacological agents. Beyond these specific examples, ongoing preclinical research continues to identify other promising therapeutic strategies for spinal cord injury. These include further investigation into specific intracellular signaling pathways to enhance axon regeneration, novel approaches like glial reprogramming to promote neuronal regeneration, and the development of various biological agents and biomaterials aimed at neuroprotection and tissue repair. While these therapies are still in the early stages of development, they offer a glimpse into the potential future of spinal cord injury treatment and underscore the importance of sustained research efforts. The period between 2020 and March 2025 has marked a period of significant advancement in the understanding and treatment of spinal cord injuries. Progress has been made across the spectrum of care, from the critical initial management of acute injuries to the development and refinement of therapies for chronic conditions. Neurorestorative approaches, including cell-based and gene therapies, continue to show promise, although their widespread clinical efficacy is still being established. Neuromodulation techniques, particularly spinal cord stimulation, are demonstrating remarkable potential in restoring lost motor and autonomic functions. The integration of neuroprosthetics and assistive technologies is providing individuals with spinal cord injury with greater independence and mobility. Nerve transfer surgery offers a targeted approach to improving upper extremity function in cervical injuries. Furthermore, rehabilitation strategies are becoming increasingly sophisticated with the incorporation of advanced technologies and a growing emphasis on community-based care and accessibility. The investigation of emerging therapies like dancing molecules and acute intermittent hypoxia highlights the innovative spirit and relentless pursuit of truly life-changing treatments within the spinal cord injury research community. These novel approaches, along with numerous other preclinical findings, offer a beacon of hope for the future. However, realizing the full potential of these advancements requires sustained and increased funding to support ongoing research endeavors and to facilitate the crucial translation of promising preclinical results into effective clinical therapies that can significantly improve the lives of individuals living with spinal cord injuries. The future of spinal cord injury treatment is likely to be characterized by a multifaceted approach, integrating pharmacological, surgical, technological, and rehabilitative strategies to achieve more comprehensive and meaningful functional recovery, ultimately enhancing the quality of life and independence for those affected by this devastating condition.